approximately.
Okay, and what about the money market?
I believe it's right at $18,000 right now.
Now, did you have the Roth account at the beginning of the marriage?
Prior to the marriage, is that what you're asking?
Yes.
Yes, sir. But it was not with USAA, it was with TD Waterhouse.
Do you remember what the balance was at that point in time?
I don't, sir.
What about the money market account? Did you have that account when you got married?
No, sir. That was inheritance.
Who did you inherit money from?
Individual's name is Herbert Cray.
Herbert
Cray.
Cray.
A-Y.
All right.
A-Y. C-R-A-Y.
And how did you know this individual?
He has been a part of my family since my family moved to Oregon when I was approximately 2 years old.
And how much did he leave you?
So I'd have to consult my records.
Okay. Do you know an approximate amount?
I believe it was somewhere around $50,000.
Okay. Could it have been $75,000?
It could have, sir.
Okay.
I have to consult my records.
Okay. How long would it take you to do that?
I don't know, a week, sir.
Well, do you think it was closer to 50 or 75?
That's what I don't recall. It came in several installments, not one lump sum.
Have you inherited any other money during the course of the marriage?
No, sir.
What did you use this money for? Where did it go?
Paid credit card bills. I loaned somewhere around $13,000 to my spouse's mother or to purchase a vehicle.
Which vehicle was that?
I believe it was a 2008 Toyota Prius.
Did she ask for that, or did you volunteer, or what?
My spouse asked for it.
Okay. Where else did the money go?
Those are the most significant, a significant amount of depreciation in the stock market would account for probably close to $10,000 in that.
Okay. With regard to your wife's health during the course of the marriage, what significant health issues do you recall your wife having?
At one point, sir.
Any health issues?
Okay. She had some kind of endometriosis throughout the marriage.
Okay. This was a diagnosis from a doctor?
I believe so, yes, sir.
Did you ever go to the doctor's appointments with her?
On occasion.
Which ones did you go to that you recall?
I went to the Mayo Clinic with her at one time, or a time or two. I don't recall exactly how many times. There may be another time or two in Las Vegas that I went with her.
Where was the Mayo Clinic at that you went to?
I believe it's Scottsdale, Arizona, sir. Not entirely sure, but somewhere in Phoenix area.
And you actually went back in the back room and was with her when the doctor met with the two of you?
I don't recall, sir.
You don't recall at all ever meeting with one of her doctors?
I've met with her doctor on occasion.
Okay. And the doctor's diagnosis was that she in fact did have endometriosis, isn't that correct?
I believe so, sir. I'm not very doctorly savvy.
Sure. How severe was it?
I cannot speak to that, sir.
What symptoms does your wife complain to you about as far as her health?
Abdominal pain.
Anything else?
I don't recall any other specific persistent symptoms.
What medication do they put your wife on to treat this endometriosis?
Lupron is one that I remember.
Okay. And how long do you recall her taking Lupron?
I can't specifically say, sir.
Did she suffer any side effects from Lupron?
I was not aware of any.
Did you ever observe any side effects from Lupron?
Sorry, I don't know.
Okay. Ultimately, she did, in fact, have to have surgery for endometriosis. Is that correct?
She did have a surgery.
Okay. What was that for?
Sir, I'm not entirely sure.
Do you remember roughly what month and year she had surgery?
No, sir.
So just to be clear, your wife did have an actual surgical procedure, but you have no idea what it was for.
It was in regard to these previous symptoms there with the, I don't know the specific ins and outs, but it has something to do with endometriosis. Sir.
Did you go to the hospital and actually see her?
Yes, sir, I believe so.
And how long was she in the hospital for?
I don't recall, sir. Not very long that I recall.
Okay. How was her condition once she was released and went home?
She was having a difficult time getting her internal biological functions back to normal.
Could you elaborate on that further?
She was having a hard time passing stool.
Okay, so you're referring to the digestive system. What did you do to help her during this period of time as her husband?
I tried to facilitate whatever bed rest I could.
Okay. How long did it take her to recover?
I don't know, sir.
Now, did she have multiple procedures because of the endometriosis?
Possibly, sir. I'm not sure.
Did they actually do a biopsy of some of the material they removed?
I don't know, sir.
Did she also have another procedure that was required to remove a tumor from one of her ovaries?
I don't recall a tumor being involved. They called it a chocolate tumor or something like that, but it, as my understanding, it was some kind of a blood mass.
Okay.
As opposed to a cancerous type of.
Which occurred first, the surgery for endometriosis or the tumor or blood mass you just mentioned?
So they're indistinguishable to me. I don't know that they're not interrelated. I don't know what the distinction between the two are.
But there were two separate procedures, correct?
I I don't know.
I guess what I'm asking is there was 2 separate occasions that she went in and had a procedure done, not just one.
That's possible, sir.
Okay. Do you recall whether there was 2 or I mean, I'm not trying to put words in your mouth, but how many times did she go in, based on your recollection, and there was a procedure done?
Sir, I honestly don't know.
Okay. Did you ever actually accuse her of faking all these symptoms?
No, sir.
So, in your opinion, this was a legitimate health problem?
It did not appear to be illegitimate.